With strong financial and organizational support from our federal government, billionaire foundations, the World Economic Forum, WHO, and health supervisory authorities are working on a plan to develop and approve new mRNA-based vaccines in the shortest possible time.
Conventional vaccines take anywhere from 5 to 18 years to be approved. Vaccines based on mRNA technology are to be developed and launched on the market within 100 days. Because of this, mRNA technology is described by scientists as a key pharmaceutical technology. Worldwide, countless conventional vaccines are currently being developed into mRNA vaccines. To mention just a few of these, vaccines against influenza, bird flu, HIV, malaria, RSV, rabies, and Zika. Billions are being invested with the aim of vaccinating the world's population using mRNA technology. It is so important to understand that these novel mRNA developments against the above-mentioned diseases are not vaccines in the true sense of the word. With the mRNA technology, humans are not injected with an attenuated and harmlessly rendered pathogen that activates the immune system, but instead an mRNA, a gene code, is injected which forces the patient's cells to produce new types of proteins. We will go into this in more detail here in our broadcast. That also explains why we will refer to the mRNA vaccination subsequently as mRNA gene injection or gene therapy. Since the start of the application of mRNA gene therapy in humans in the context of the alleged COVID-19 pandemic, it has become clear that mRNA injections are extremely harmful and even fatal for humans. KLA-TV has documented this in numerous programs in recent years. Numerous scientists and doctors spoke out on this, and many studies were cited. Nevertheless, countless billions are currently being invested in the further development and production of mRNA technology. Some examples. Novartis CEO Vasant Narasimhan announced at the beginning of 2025 at the World Economic Forum that new mRNA therapeutics against non-communicable diseases would be developed biannually. The European Commission granted approval for a self-amplifying mRNA injection at the beginning of 2025. And last but not least, U.S. President Trump wants to invest $500 billion in AI mRNA technology against cancer. In view of this massively driven development, KLA-TV will summarize here some of the most important expert voices from the German-speaking countries. They demonstrate why there must not only be a massive warning against mRNA technology, but why its application must be described as a crime against humanity. Because the mRNA in the gene injections is artificially produced and differs from human DNA, it can also be referred to as mod RNA, mod standing for modified or altered.
mRNA gene injection, cause of sickness and death.
In September 2024, Dr. Ute Krüger published images of unprecedented tissue damage in patients after the corona gene injection, which led to death and illness in many of them. The pathologists, Professor Dr. Arne Burkhardt and Professor Dr. Walter Lang, were able to prove in tissue samples as early as January 2022 that the vaccine spike protein in the blood vessels of a vaccinated person led to myocarditis. The person in question died 4 months after the COVID-19 gene injection. This is just one example of an innumerable amount of similar cases of damage worldwide. Professor Dr. Arne Burkhardt also demonstrated in tissue samples from vaccinated people in March 2022 that vascular damage and blood congestion occurred in small and large vessels, as well as myocarditis and pneumonia caused by inflammatory cells. Professor Dr. Zuckerit Bhakti warned in February 2022, "The proof is there, gene-based vaccinations destroy the immune system." In August 2023, he explained why the mRNA gene injection leads to brain inflammation and heart inflammation. In an interview with KLA TV at the end of 2024, he reported that a study by the National Academy of Science had now clearly proven and documented the causality of heart muscle inflammation with the vaccination. Worldwide studies and investigations show severe vaccine damage even in children after mRNA gene injection. Children who were perfectly healthy before the vaccination suffer severe side effects afterwards, such as inflammation of heart muscle. Other children suffered a stroke or even died after being vaccinated. In March 2023, a press conference was held by the Society Physicians and Scientists for Health, Freedom and Democracy (MWGFD) on the topic Gene-Based Vaccines, the Pharmaceutical Crime of the Century. Amongst other things, human and cell biologist Professor Dr. Ulrike Kämmerer made it clear that the spike protein is a bioweapon with enormous potential to damage. It is becoming increasingly clear that this is not a health policy project, but it is a military project.
mRNA gene injection, cause of cancer and turbo cancer.
Dr. Ute Krüger proved in November 2024 that the mRNA gene injection can trigger cancer and turbocancer. Turbocancer is an extremely fast-growing and aggressive tumor tissue that can also affect young people. This explosion of cancer often occurs in several organs just a few months after vaccination. The same thing was reported at the pathology conference in Reutlingen in October 2021. One patient had breast cancer that was already under control and had stopped growing. After administration of the mRNA gene injection, the patient experienced explosive cancer growth. A 2023 study from Great Britain examined 15 to 44-year-olds who died of cancer. It turns out that in 2022, exactly 1 year after the introduction of mRNA gene injections, there was an increase in fatalities in this age group of between 12 and 120%, depending on the type of cancer.
mRNA gene injection, genetic engineering in humans.
The molecular biologist Professor Dr. Klaus Steger and Professor Dr. Alexandre Ariancode, specialists in the field of RNA and epigenetics, have briefly summarized the latest research results on mRNA-based vaccine technology in a flyer. Their findings are as follows.
mRNA technology in the form of vaccines can lead to the following in humans. Chronic inflammation in any organ in the body, for example heart muscle inflammations such as myocarditis and pericarditis. The modRNA can be integrated into the DNA of human cells. If this takes place in the male or female germ cells, the genome of future generations is altered. Through modRNA vaccine technology or with the incorporation of modRNA into the body's own cells, this can lead to new types of cancer and can cause turbocancer in people who already have cancer. According to biologist Dr. Ulrike Kämmerer, the corona vaccination cannot be called a vaccination. Dr. Kämmerer said the following about this in an interview.
It's not a vaccine in that sense, it's genetic engineering. It is also not gene therapy because nothing is being treated, but it is genetic engineering. This means that all those who receive these injections, including future vaccines, are initially involuntarily genetically modified organisms.
Dr. Bhakdi confirmed this as follows.
The uptake of a functioning foreign gene is equivalent to genetic modification of the cells. In other words, the vaccinated became genetically modified organisms. Over days, maybe months, we don't know. That is criminal. This is a capital offense.
mRNA gene injection always leads to autoimmune diseases.
A new study on mRNA research from England was published on December 6, 2023. Roughly speaking, this study is about how known malfunctions of artificially modified RNA, modRNA, can be avoided or at least reduced. This is because an mRNA vaccine is not natural mRNA, which is normally read in the cell, but modified RNA. This means that a building block of the mod RNA is artificially modified. This artificial mRNA is read in the cell, and the cell uses it to produce a protein consisting of a series of amino acids. Because one building block of the mod RNA is artificial, reading errors occur in the cell when the mod RNA is read. These reading errors lead to the cell producing a protein that is foreign to the body. Professor Dr. Sucharit Bhakdi and Dr. Ronald Weichel discuss about this in the following video clip.
And an incorrect amino acid sequence means a reading error. That is, that the whole protein is a different one. And there can be thousands of them. So the consequences are monstrous. But one consequence is certain. This protein is also foreign. Whether it is the spike protein or not, it is a foreign protein, because this recipe does not exist in our genome. And that is why this cell is now being attacked, not just because of the spike, which is also formed, but because of the wrong proteins that are formed. Think about it. Yes, and it's getting worse and worse and worse.
The online newspaper achgut.com explains the problem as follows. A new publication in Nature magazine shows that mRNA vaccines can promote the formation of unwanted proteins. This shows that the authors have not understood the basic problem with mRNA vaccines. It is not the reading frame shift, which can be seen as an unintended side effect of the vaccination, but the main effect. This is the expression of a toxic foreign protein in uncontrollable quantities in all types of body cells, which leads to the destruction of these cells when the immune system recognizes the foreign antigens in the cells. This leads to massive damage to the endothelium and to the organ parenchyma, which leads to coagulation disorders, death from stroke, heart failure, damage to the fetus during pregnancy, and to numerous chronic diseases, and probably also leads to infertility.
DNA residues in mRNA corona gene injection, trigger of turbocancer.
Since February 2023, various laboratories have detected residues of plasmid DNA in all tested batches of the COVID-19 vaccine from Pfizer-BioNTech and Moderna, the concentration of which was significantly above the currently recognized limit. In early January 2025, a doctor from the Czech Republic detected large quantities of residual DNA in the Moderna and Pfizer mRNA gene shots. This occurs so frequently that it can no longer be considered accidental contamination. Professor Klaus Steger and Professor Ulrike Kammerer from Physicians and Scientists for Health, Freedom and Democracy have commented on this.
These are not impurities, but residual DNA from the manufacturing process. The European Medicine Agency knew that the mRNA gene injections contained DNA residues. High-ranking employees of the Australian Therapeutic Goods Association (TGA) knew that elements of RNA or DNA from the genetic vaccines can penetrate the cell nucleus and also integrate into the genome, although the agency officially denies this. The possible consequences. Each integration of a DNA sequence can interfere with the expression of the subsequent gene. If, for example, a tumor suppressor gene that inhibits cancer growth is inactivated, this promotes the development of cancer. In combination with a general immunosuppression through regular boosters, the conditions for fast-growing tumors or turbocancer are fulfilled.
Lipid nanoparticles, the Trojan horses of our time.
Professor Dr. Klaus Steger is a molecular biologist. He gave a lecture entitled The RNA Platform, a Trojan Horse, at a lecture series organized by the Physicians and Scientists for Health, Freedom and Democracy Association. Among other things, he commented on the lipid nanoparticles contained in the mRNA gene therapies. You can access the full presentation by clicking on the image here.
The Trojan horse was used by the Greeks to overcome the walls of Troy and conquer the city. And the Trojan horses of our time are called lipid nanoparticles, which contain RNA that is then transported across the cell boundaries into the cell interior, where it hijacks the cell apparatus and forces our cells, they don't do this voluntarily, to produce a foreign viral protein. The basic idea alone would actually be enough to never use this technique on humans. LNPs are also used in our COVID-19 vaccines. And LNPs are no comparison with natural viruses or viral shells. They are not recognized as foreign by our immune system. And they can theoretically attack any cell. This means that a virus only ever attacks very specific cells that have the corresponding receptor. These lipid nanoparticles can theoretically attack all cells. And the most worrying thing is actually the cationic lipids, which are positively charged because the inside of our cells is negatively charged. These cations can therefore practically make holes in these cell membranes, as can be seen in the bottom right. Inflammatory reactions can occur, keyword free radicals, abbreviated as ROS. This is of course bad for the mitochondria, which are our energy producers, keyword ATP. And if DNA is affected, this leads to apoptosis, which is cell suicide. The lymphocytes appear to be particularly affected. The number drops. This leads to a general immunosuppression. And you can see that the more often someone has received the injection, the more often they will get corona or other infectious diseases. This review also links it to rising cancer rates, because we know that T cells play an important role in the detection and elimination of cancer cells, which are practically created in our bodies every day, but are then wiped out.
mRNA gene injection therapeutic vaccination against cancer?
In January 2025, Donald Trump announced a supposedly historic AI infrastructure project with SoftBank, OpenAI, and Oracle. Larry Ellison, the founder of Oracle, said that one of the most exciting projects they were involved in was a cancer vaccine. This is said to be an mRNA vaccine that can be produced automatically within 48 hours using AI, and should lead to a rapid cure for cancer. In other words, a so-called mRNA-based vaccine against cancer is being propagated. It is important to understand that, as already explained, this will have the potential to cause cancer itself. On March 10, 2025, the Physicians and Scientists for Health, Freedom and Democracy raised the alarm against the use of mRNA or similar gene-altering treatment methods against cancer. The complete statement can be found under this link.
Research into gene-altering cancer therapies has been going on for a long time, but there have been no crucial successes. The problems responsible for this failure will not be solved by the use of mRNA and artificial intelligence. The application of artificial intelligence to design individually customized mRNA therapies will probably make the results very difficult to compare. This creates completely new opportunities for fraud in the evaluation of clinical studies. For example, chocolate is ineffective, but dark chocolate with hazelnuts works wonders. Previous experience with pharmaceutical companies that propagate these therapies unfortunately give cause to such concerns.
More than 2,000 doctors call for an immediate stop to mRNA technology.
The HOPE Accord was published in July 2024. More than 2,000 doctors demand, among other things, the immediate suspension, the stop of COVID-19 mRNA gene-altering injections.
Growing evidence suggests that the widespread introduction of novel COVID-19 mRNA vaccines is contributing to an alarming rise in disability and excess mortality.
Ladies and gentlemen, the scientific facts of the massive harmfulness of mRNA gene-altering jabs for humans are on the table. Why is the scientific world not internationally rejecting this technology? First, an answer to the question, who is promoting and funding the mRNA jabs?
Who is promoting and funding the development of mRNA jabs? The Gates Foundation.
The Gates Foundation announced funding totaling $40 million to improve access to the low-cost mRNA research and production platform called Quantum Biosciences.
CEPI, a global vaccination alliance.
BioNTech and the Coalition for Epidemic Preparedness Innovations, CEPI for short, promote local research and development as well as clinical and commercial production of potential mRNA vaccines in and for Africa. CEPI is providing up to $145 million for this purpose. CEPI was launched in 2017 during the WEF annual meeting in Davos. KLA TV has already reported in detail on the Freemasonic background and aims of the WEF. In addition to the WEF, the founding members of CEPI included the governments of Norway and India, the Bill and Melinda Gates Foundation, and the Wellcome Trust, the world's second-largest foundation that allegedly funds medical research. In the meantime, CEPI is financially supported by around 35 countries. CEPI aims to develop and launch mRNA-based vaccines in the market within 100 days.
These are just some of the most important sponsors of the mRNA gene injections, which are and have been financed with public funds from taxpayers' money from various countries. According to a press release from the Kennep Foundation, the development, approval, and production of coronavirus preparations, including mRNA injections, was financed worldwide with a public fund amounting to $88.3 billion until the beginning of 2021. This means that many citizens have co-financed the damage or even destruction of their own bodies and are now continuing to finance it themselves.
Conclusion.
Ladies and gentlemen, dear viewers, despite all this evidence and the obviousness of the enormous harmfulness of mRNA gene injections, they are still being developed. We remember, among other things, the mRNA gene-altering jabs against influenza, bird flu, HIV, malaria, RSV, rabies, Zika, etc. In addition, several so-called mRNA cancer vaccines are in clinical trials, 2 of which are close to approval. And as the past has shown, mRNA vaccination could also become compulsory in the future. There is an elementary principle in medicine that goes back to the Hippocratic Oath, and this is primum non nocere, which, when translated, means that the doctor should first do no harm with the medical treatment or therapy. Why is this principle being disregarded here? Although all the facts summarized in this program were known shortly after the start of the worldwide mRNA vaccination campaigns, the vaccinations were not stopped. As a result, thousands and thousands of people have lost their lives. However, the fact that they are now going even further and also want to convert the majority of all conventional vaccinations into mRNA injections allows only one conclusion. This is about a purposeful agenda. The Georgia Guidestones could provide an answer to the question of what this agenda is. This gigantic granite monument was located in the U.S. state of Georgia and was sometimes referred to as the American Stonehenge because of its appearance. Built in 1980 by anonymous builders, it was destroyed by an explosive attack in 2022 and has now been removed. An inscription with 10 guidelines was carved into the massive stone blocks in 8 modern languages, from English to Swahili. 2 of the 10 commandments read as follows: maintain humanity under 500 million in perpetual balance with nature. This may sound nice, but it clearly speaks of a massive reduction of the world's population. Because with a current figure of over 8 billion, that means 7.5 billion people would have to be eradicated. Guide reproduction wisely, improving fitness and diversity. The Guidestones describe the future world as planned by occult secret societies. KLA-TV reported in detail on this. These goals are also reminiscent of statements by the highly acclaimed WF advisor Yuval Noah Harari, who speaks of, quote, useless people, or of the eugenic ideas of Bill Gates, or organizations such as the Galton Institute, formerly the British Eugenics Society. Is it any wonder that they and their foundations are financing the harmful mRNA technology in conjunction with the WEF? One may accept or reject this explanation as the goal behind this massive vaccine research on the mRNA gene injection and its planned worldwide application. Whatever you may do, one thing is certain. With the intensified research for further mRNA gene injections, intended for use, for example, against malaria or as the annual influenza shot, massive damage is coming to mankind. Inform relatives, friends, and acquaintances about this gene injection as long as you can still talk about it openly. Help us to warn the world population. Only by rejecting these mRNA gene injections can the threat of massive damage to the world's population be averted.
A research project by KLA-TV, your #1 independent broadcaster, www.kla.tv. Share this video widely. Knowledge is power.